How does one recognize autism spectrum disorder? More and more individuals are questioning whether they have this condition in their adult lives, and actually we are also becoming better at detecting it. While this is a neurodiverse condition, which means that it needs to present early in life, sometimes it is not recognized when individuals are younger, and the impact is felt throughout an individual's personal and professional life. There are two main characteristic domains which I'm going to explain in detail today, but I want to clarify that even within these two domains, the presentation or characteristic traits of different individuals with the same diagnosis may vary widely. There are also differences in how male and females with autism spectrum disorder present. So every individual with autism spectrum disorder will have their own set of individual characteristics within these two domains. And many times there are many other conditions like depression, anxiety, and adult ADHD which can co-occur with autism spectrum disorder. So presence of these conditions does not mean that one cannot have autism spectrum disorder. Ideally, early diagnosis is best because of what we call neuroplasticity, or the brain's ability to change in the younger years. Some individuals also develop many adaptive strategies through their years, which means that they are able to overcome the difficulties with age. Let me give you an example of someone I know. Lara sought help as she had recently dropped out of college. She had been a loner throughout her school years, and her teachers would say she spent a lot of time alone in the library or on the friendship bench during her school breaks. In fact, even at home, she was happy being by herself in her world. She made a couple of friends over the years and became comfortable with them. She enjoyed physics, but when it came to abstract concepts in English, she really struggled. She was quick to experience meltdowns, especially when her parents changed plans. Her mom said from a young age there were tantrums if her sister took her clothes or took a book from the bookshelf and did not place it in the exact place. Socially, things had improved to some extent as she became older and she had learned to read the room, but this was very tiring for her because she felt she was wearing a mask a lot of the time and could not be herself. She dropped out of college because she felt very anxious and overwhelmed due to the lack of structure in the way college was, and she also struggled with the noise levels. When I met her, she was extremely anxious, and therefore that was the first thing we needed to overcome. There are various reasons for anxiety, but when we considered the bigger picture of Lara's difficulties, it became clear that she would benefit from a specialist assessment of autism spectrum disorder. As I said, there are two main broad criteria domains for the diagnosis of autism spectrum disorder in addition to other criteria. The first is persistent difficulties in social communication, social interaction in multiple contexts. For example, individuals may have difficulty in developing, maintaining, and understanding relationships, ranging from, for example, difficulties adjusting to behavior to suit various social contexts, like in adjusting to their conversations or realizing when they have upset somebody or said the wrong thing, or how to cover up a social mistake, or to difficulties in sharing imaginative play or in making friends, to the absence of interest in friends, colleagues' interests, and understanding where they are coming from, say, in conversations, and understanding the context of conversations. Individuals may have difficulty in social emotional reciprocation, ranging for example, from an abnormal social approach and failure of normal back and forth conversation to difficulty understanding implied meanings in conversations, for example, humor, satire, irony, to reduce sharing of interests or emotions, to failure to start or respond to social interactions. Often people say that they rarely text or message their friends. Individuals can have problems in non-verbal communicative behaviors often used for social interaction, ranging for example, from poorly integrated verbal and non-verbal communication to abnormalities in eye contact and body language, or difficulties in understanding and use of gestures to a total lack of facial expressions and non-verbal communication. The second criteria domain is restricted repetitive patterns of behaviors, interests, or activities as manifested by at least two of the list that I'm going to give. Stereotyped or repetitive motor movements, use of objects or speech. For example, single motor stereotypies like lining up toys or flipping objects, or what we call echolalia, which is like meaningless repetition of words or idiosyncratic phrases that others don't understand. Or insistence on sameness, inflexible adherence to routines or ritualized patterns or verbal, non-verbal behavior. For example, extreme distress at small changes, difficulties with transitions, rigid thinking patterns like black or white thinking or all or nothing. It's either this or it's that. Rituals like greeting rituals need to have the same route to work, eat the same lunch every day, or highly restricted fixated interest, abnormal in intensity and focus. For example, a strong attachment or preoccupation to unusual objects, excessively subscribed or perseverative interest, doing the same thing again and again. So many people give examples that they have an interest in a particular topic and they'll spend like 8 hours researching it. Or they have collectibles and they are quite preoccupied with their collectibles. And these are the kind of perseverative interests that people talk about. But then again, every individual is different. Or hyper or hyporeactivity to sensory input and unusual interest in sensory aspects of the environment, like an apparent indifference to pain, temperature, adverse response to specific sounds or textures. And moms would say, he always wears the same color t-shirt with the same texture, or the same jumper, or need the same colors. Excessive smelling or touching of objects, visual fascination with lights or movement. So again, comes in the same bracket. Now there are 3 other criteria for the diagnosis in addition to the first 2 that I have just talked about. Number 3 is symptoms must be present in the early developmental period, although sometimes they may not become manifest until the social demands exceed and there is limited capacity, or they might be masked by learned strategies in later life, like I was discussing earlier. Number 4 is symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. And number 5, these disturbances are not explained by intellectual disability, which can include intellectual developmental disorder or global developmental delay. Of course, intellectual disability and autism spectrum disorder can occur together. In fact, they do occur together quite a lot, but it means it cannot explain it. We assess severity levels by the amount of support required by the individual. So now that you know it all, if you believe you have the 2 symptom domains that I have just described, please start documenting, start journaling with lots of examples. When did it start? How did it progress? How have you coped? But remember, if these things are affecting your life, please seek help. Please subscribe to my channel if you haven't already done so. The more subscribers I have, the more ability YouTube gives me to make more creative videos. Like it, share it, tell it to all the people you know. And thank you for watching.